Hi, my name is Anuswa Acharya, and this is my video for dressing change using a sterilized technique. So, for before starting the video, I'd like to show my hand, which is empty, no watch, no ring, no nail polish, and my sleeves are up. So, for the video, I have my supplies as my wound is ready. I did put the band-aid on the wound. I have my biohazard bag and sanitizer, sterilized gloves, and wound cleaning kit. Also, my clean gloves. Now I would start my video. I will wash my hand and I will enter the room of the patient. I will close the curtain for privacy, and now I'm going to introduce the patient, and then do the two-way verification with the patient and explain the procedure. So, hi, Mr. Smith. This is me, Anuswa Charya. I'm going to be a nurse for today. So I'm here to do your dressing change on your own. Can you tell me your full name and date of birth, please? Um, Okay, I did verify the patient with two ways verification. Now I'm gonna do the hand sanitizer. Then I'm gonna put the clean gloves on. Okay, Mr. Smith, I would like you to hold on still, and I'm gonna take your old dressing out by inspecting the wound for the tissue type, color, odor, or drainage, or I'd also measure it if mentioned by the provider. I'm gonna peel all the corners of the wound first. Peel the corner first. Then I'm gonna peel the four corners first, and then I'm gonna take it out parallel to the wound, and I'm gonna toss it in the designated biohazard bin, being careful not touching the inside part. I would like to inspect for the wound by checking for any odor, any drainage, color, type, and I would also measure the wound if recommended by the provider. So now I find no concern to the wound, so I'm gonna take my gloves off, which is dirty now. I'm gonna put it in the designated biohazard bin. Now I'm gonna use the sanitizer in my hand, and now I'm gonna put the sterilized gloves in, being very careful. Without breaking the sterility. I'm gonna do the process now. So for now, I'm just gonna move my kit on the left side so that it'll be easy for me, and I'll have my space here uh, to put the sterilized gloves on. So I'm gonna be very careful. Um, Being careful to put the gloves on. So I'm gonna open the sterilized gloves, and without touching the inside of the gloves, and only touching the, the designated space, making it straight. So I'm going to use my left non-dominant hand to put on my right gloves first. I'm just going to pinch the edge of the gloves, and put my hand in. I'm gonna be very careful. I'm gonna do this simmering and put the glove, pull the glove up. So my right hand is done. Now I'm gonna use my sterilized gloves hand to put on my left hand gloves. So I'm gonna put my four fingers, sterilized gloves, and pick it up, and I'm gonna remove my thumb. Then I'm gonna put my left hand in. So as I did put my both the sterilized gloves in, I'm just gonna interlock it and try to fix it. Um, being very careful, not putting the sterilized hand below my hip, below my hip. Being very careful. It needs to be sterilized. It is sterilized, so not touching anywhere else. So now I'm gonna introduce. I'm gonna say that which is gonna be my working hand, and which is gonna be my clean hand. So for now, I'm just gonna leave this one here because it's not creating me any trouble. So this left gonna be my working hand, and right is gonna be my clean hand. So from the working hand, I'm just gonna open my sterilized kit, my own kit. So I'm gonna take the swab out. I'm gonna take the swab out and put it on my right hand, my clean hand, and I'm just gonna take the swab, and I'm gonna take the swab and clean the wound. I'm gonna clean the wound in the circular motion, inside out, being very careful. So just gonna circular motion inside out. Now I'm gonna toss it in the biohazard bag, being very careful without not touching the inside part. I'm gonna take my 2 by 2 and toss it on my right hand. So I'm gonna do the same. I'm gonna dab it inside out on the circular motion. I'm gonna throw it in the trash bag. For now, I'm gonna put my transparent dressing, my Techodrum. So I'm gonna take the Techodrum out. So for this one, I'm gonna use my both the hand, without breaking the sterilizing. So I'm gonna use my both hand. I'm gonna open the packet. I'm gonna place it over the wound, being very careful. And taking the extra package off and putting it in the designated biohazard bin. So looks like it's all clean and intact. So I'm done with my sterilized gloves process by cleaning the wound and putting the new dressing on. Now I'm gonna take my gloves off, dirty gloves off, by pinching in the middle and just pulling it out, making bow, and doing the same left side, and I put it in the biohazard bin. So I'm gonna put my other packages in the biohazard bin too. Everything needs to be properly disposed, and being very careful to not break the microorganism organism to be everywhere. So I'm just gonna I'm done here. Gonna use the sanitizer and sanitize my hand. Okay, Mr. Smith, I'm gonna place you in a comfortable position. So I'm done with my process. I'll call if you need something. I'll see you in a while. Here's your call light. Okay, now I'm gonna step out of the room, wash my hand, and document the process. Thank you so much.